All right, today we're jumping right in to demystify endometrial cancer. We're going to break down what it is, what causes it, and how it's treated. It's a really important topic, so let's get a clear picture of it together.
Okay, let's kick things off with a number that might actually surprise you. 25%. That's right, a full quarter of all endometrial cancer cases happen before menopause. This really goes against the common idea that it's a disease that only affects post-menopausal women.
And a stat like that really drives home why it's so crucial to understand this stuff. So let's start at square one. What even is endometrial cancer? Well, to put it simply, it's a type of cancer that begins right there in the endometrium. That's the inner lining of the uterus. But here's the really crucial part, the key takeaway right from the start. Most of the time, it's caught early. And this is such a big deal. The reason the prognosis is usually good is because the main symptom, and we'll get to that in just a minute, tends to show up pretty clearly, leading to an early diagnosis. So that really sets a hopeful tone for the rest of what we're going to talk about. Okay, so to really get why this cancer develops, we have to dig into the risk factors. And when we do, a very clear theme starts to pop up. And that theme, it's all about excess estrogen. A whole lot of the main risk factors are directly linked to things, whether it's life events or health conditions, that just increase the body's overall exposure to estrogen. So the key idea here is anything that extends your lifetime exposure to estrogen can bump up the risk. We're talking about things like nulliparity, that's a term for never having carried a pregnancy, or early menarche, which just means you started your periods at a younger age, or on the flip side, going into menopause later in life. It also includes taking estrogen therapy on its own without that balancing hormone, progestogen, to go with it. But it's not just about hormones. There are also really strong links to metabolic health. So things like obesity, diabetes, and polycystic ovarian syndrome, PCOS, they're all major risk factors. And then you've also got the use of the breast cancer drug tamoxifen and a specific genetic condition called Lynch syndrome. They're all part of the picture. Okay, but it's not all doom and gloom about risks. There are also things that can be protective. And honestly, one of them is pretty surprising. So, as you could probably guess, multiparity, which means having had multiple children, and using the combined oral contraceptive pill can actually be protective. It's most likely because of how they help regulate your hormone cycles. But then there's the third one on the list, smoking. Whoa, okay, let's be super clear here. This is not, I repeat, not advice to start smoking. Absolutely not. It's just this really fascinating, kind of weird correlation that even the medical literature points out isn't well understood. Researchers are still scratching their heads about why it seems to have this protective effect. All right, now we're getting to what is probably the most important part of this whole explainer, the signs and symptoms. Because knowing what to look out for, that's the absolute key to the early detection we mentioned earlier. So, out of everything, what is the classic symptom? The one single most common sign that should always be checked out? Post-menopausal bleeding. That's it. This is the big one. Any bleeding at all after menopause, I don't care if it's slight, if it's intermittent, if it only happens once, it always needs to be looked into by a doctor. And honestly, this is exactly why this cancer is so often caught early. It's a symptom that's hard to ignore, right? Now, for women who haven't gone through menopause yet, the signs can be a bit different. They might experience what's called menorrhagia. That's just really heavy or long-lasting periods, or maybe some bleeding between their normal cycles. It's also worth noting that things like pain or weird discharge, they are not common early symptoms. Okay, so if someone does experience these symptoms, what's next? What happens? Let's walk through the typical steps for getting a diagnosis and then managing it. The whole process is actually very well structured. It usually starts with an urgent referral from your doctor. The first big test is a trans-vaginal ultrasound, which lets them measure the thickness of the endometrial lining. After that, the next step is usually a hysteroscopy. That's where they use a tiny camera to look inside the uterus and take a small tissue sample, a biopsy, to send off for testing. And during that ultrasound, there's a really key number they're looking for. If that endometrial lining measures less than 4 millimeters thick, the chances of it being cancer are extremely low. It has a high negative predictive value, which is just a fancy way of saying it's a very reassuring result to get so early on. So when we talk about treatment, the gold standard, the main approach, is surgery. This usually means a total hysterectomy with a bilateral salpingo oophorectomy, which is a mouthful, but it just means they remove the uterus, cervix, fallopian tubes, and ovaries.
Now, for some patients who might be too frail for such a big operation, there is an alternative: progesterone therapy. They can use that same balancing hormone we talked about earlier to try and counteract the estrogen's effects. And for patients who are found to have a higher risk or more advanced disease, radiotherapy might be recommended after the surgery, just to make sure any lingering cancer cells are taken care of.
But let's just circle back and be crystal clear. The primary, most effective treatment, the real mainstay here, is surgery. That is what leads to the generally good prognosis we talked about right at the start.
So we've gone through the what, the why, and the how. We've looked at the risks, and most importantly, we know the signs to watch for. So I guess the final question is, now that you know all this, how can you use this knowledge to feel more empowered in conversations about your own health, with your doctor and with the people in your life? Thanks for joining me for this explainer.